This is SG2 Perspectives, a conversation with SG2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
The whole concept of the Amazonification of healthcare and consumer expectations increasingly growing and being shaped by external factors outside of the industry. They want transparent pricing. They want easy access. They want it to meet their lifestyle needs. When you have folks like Amazon and CVS Health coming into the home and providing these services, it's continuing to push that expectation that we can get these services in the home.
Hello and welcome to SG2 Perspectives. I'm your host, Tori Ritchie. Today, I am joined by two of our experts, Donnell Jagman and Nikita Arora. We are going to take a deep dive into the impact of change impact factors, focusing our conversation specifically on the economy and consumerism impact factor. Donnell, Nikita, thank you so much for joining.
Good morning.
Thanks for having us.
A lot that we consider for this impact factor, but there are two key stories that we try to incorporate and consolidate within this particular space: direct-to-consumer impacts and price-sensitive conditions. Nikita, Donnell, I'm going to play back for you a clip from the inaugural IOC podcast, and I'm curious to get your reactions on how specifically this trend affected those two forecast areas. Something that we considered quite a bit was the budget reconciliation and what is likely to happen in terms of number of enrolled lives in programs like Medicaid and the marketplace exchanges, and how attrition is likely to then affect care utilization patterns. And if we see that attrition, we recognize that demand for price-sensitive services, care that's often deferred or delayed because of access and cost barriers, we're likely to see attrition in that area. Top conditions include things like pain management, behavioral health, chronic disease management, annual wellness screenings. Donnell, curious from your perspective as it relates to some of these consumer drivers and what that means for orthopedic, sports medicine, and pain management programs.
Tori, this is such a complicated area right now in orthopedics because we know that there's more surgery than ever. We see the need and demand for things like physical therapy increasing, but there are tools now like those direct-to-consumer physical therapy or exercise therapy tools that are taking that physical therapy care out of the health system's reach where it's in the hands of patients. Now, a lot of this is through your employer-provided health care plan where you have free access to these exercise therapies, not directly related to surgery for those patients, but this is the precursor to patients getting on-hands care. And they might not be using that direct access to real-life physical therapists as that initial touch to a healthcare system instead. At the same time, there's things like remote physical therapy, which is augmenting in-person care and supplementing it, totally replacing it or helping our physical therapists be a little bit more efficient, see more patients, and monitor patients when they're not in our offices or in our spaces.
Thinking about ortho and those direct-to-consumer offerings, even though there is demand, how do you balance building that forecast knowing that some of that activity is not being captured? For listeners tuning in, the forecast captures billable volume. So a direct-to-consumer model does not necessarily yield a claim that an insurance payer is capturing.
That's why it is complicated. We look at how those things might decrease the billable claims aspect, and it might not be as much as you think. There will be some decrease in billable claims, and that's also due to other things like price sensitivity in the economy, not just the consumerism aspect, as well as some folks don't want to go to physical therapy and they don't fulfill all of their visits. And we have seen some studies that have debated the efficacy of physical therapy, especially in surgical recovery. Both sides of that story have their own arguments, and there's no line to draw there right now. We are going to see a decrease in the claims amount volumes for physical therapy, but it doesn't decrease the entire growth of physical therapy. It just dampens the growth. You'll still see growth in our forecast for physical therapy evaluations, the treatments themselves, at home, chiropractic visits. All of those will have growth in our 10-year forecast. They've just been dampened slightly by that econ and consumerism factor.
And Nikita, you work on the post-acute forecast. How do you and Donnell triangulate what makes sense in terms of a growth rate for that brick and mortar, in-person, physical, occupational therapy forecast versus that shift to home? Is that something that we expect to see ramp up over the decade?
There are a number of factors that are contributing to the growth in the home PTOT space. One is that we have an aging population. There is that demand, and that's going to be a huge influencer in that growth. The whole concept of the Amazonification of healthcare and consumer expectations increasingly growing and being shaped by external factors outside of the industry. They want transparent pricing. They want easy access. They want it to meet their lifestyle needs. When you have folks like Amazon and CVS Health coming into the home and providing these services, it's continuing to push that expectation that we can get these services in the home. Another factor that plays into the growth of home PTOT is we're seeing a lot of site of care shift dynamics. As more folks have their procedures done in the outpatient setting, they no longer qualify for that admission into a SNF for that follow-up post-op care. So they're going to seek those services elsewhere. And oftentimes that turns into the home. Donnell, what else would you add there?
The American Joint Registry this year reported that most joint patients for hip and knee replacements are discharged to home. You're not getting those inpatient or hospital-based rehab visits as often or with the frequency that we did previously, where you might only see a rehab professional during your procedure visit. I won't call it a hospital visit, just right before you're discharged to home. And depending on your mobility and your access to transportation, all of those things may lead you to get that home therapy instead of going to and from a medical facility to get that instead. And we've seen excellent improvements and better outcomes for patients who recover from home from these major joint surgeries.
Nikita, I want to dive a bit deeper into some of the fantastic consumerism work that you've done as of late. As it relates to affordability, price sensitivity, given some of the economic pressures that we are experiencing, what seems to be top of mind for consumers when shopping around for services these days?
Cost is always going to play a factor into where our consumers are seeking their healthcare services. At the same time, what we've seen come out as a priority in this latest iteration of the survey is consumers want connectivity, that ongoing connection to their provider and longitudinal care. If there are gaps in service offerings as they exist today, consumers are still willing to pay out of pocket for certain services. One of our statistics was among 65% of the consumers who use wellness services, 42% of them are spending over $100 a month out of pocket for these services. That's on things like alternative care, holistic services, your ongoing health support, which is a big indicator that it's not just discretionary. It is a demand for these services. If we're not providing them as health systems, they're going to seek them externally through disruptors.
Donnell, is that a trend that you've started to see within orthopedics and sports medicine offerings? I'm just thinking about there's a lot of growth in that ambulatory sports medicine space where organizations, whether traditional health systems or not, are actively scaling healthcare offerings. Are you seeing increased connectivity within that patient care journey, or are we still pretty nascent there?
We're seeing that physical therapy is one of the main drivers of patient loyalty in some of our longitudinal spend data. We have some example healthcare markets that we've pulled that show over an average 3-year period, patients who enter through the physical therapy channel as opposed to urgent care, specialty, or primary care spend almost or greater than $10,000 over that 3-year period than those others. It's across different specialties too. It's not just for orthopedic patients. In addition to that, what I'm recommending to our members who are trying to achieve a comprehensive and complex care environment for physical therapy, orthopedic, sports medicine patients is to offer those cash-based services. Having cash-based physical therapy as an option for patients can be important, especially in markets that have multiple major insurers and where you might not accept every insurer in the market. Patients like to choose where they go for this. That location preference has also changed over the past 5 years, where everybody wanted to be close to work because you went to work every day. So you wanted to get your physical therapy on your lunch or before or after work. Now you might be home some days, so you want to get your physical therapy closer to home. And you might just have a preference, especially in today's environment where we're seeing retirees stay more active and more physically demanding sports, to return to your pickleball game faster than your insurance might allow. So you might choose to pay out of pocket so you can see your physical therapist more frequently than your insurance would cover. When you're thinking about comprehensive sports medicine programs, you get into things like performance enhancement, injury prevention, specialty training, and some of those sub-ancillary, I don't even want to call them ancillary because they're tertiary ancillary services like massage, nutrition counseling, acupuncture, and the like throwing and gait analysis that is available now with technology.
I feel like two separate bodies of research, but mirror one another in some of those key takeaways that helps underscore then this concept of care orchestration, Nikita, that you and Yelena talked at length about during the recent consumerism webinar. It helps underscore the importance of that approach to care delivery. For folks that perhaps haven't had an opportunity to listen to the consumerism webinar, would you mind giving listeners a brief description of care orchestration?
Absolutely. The idea behind care orchestration and where it's fueling from is just taking a look at how services have traditionally been delivered and how it's going to require a mindset shift to transition into this concept of care orchestration. We are very transactional focused. It's you have your visit, you may have a follow-up appointment, and that's it. The goal is to deliver care a little bit more efficiently, a little bit more effectively, and the relationship doesn't end when the visit is over. It's an ongoing, continuous living and ever-changing experience. Not just an episodic service, but the provider is more of an orchestrator of a person's health journey. The consumer is going to be surrounded by insights from the provider, connection, ongoing support over a period of time across different settings. And often all of this is happening in the background. These communications are going on, and it's not going to be possible without a focus on technology. You need technology. You need that digital background foundation in order to help orchestrate this care.
Taking all of this into consideration, we have economic pressures, consumer behaviors are shifting, consumer preferences are continuing to shift as we push toward a more orchestrated, a less transactional care model. Nikita, Donnell, what is a word of advice? Where should organizations start as they seek to remain competitive in this space? Nikita, I'll start with you.
Organizations who start by focusing in on what their consumers are doing in the market, paying attention to this activity and understanding that it's not just about some of the surface level fixes that we've been talking about for many years at this point. Yes, same day appointments are important. Yes, scheduling convenience is important, but there's other underlying factors that are going to influence the overall satisfaction that a consumer feels when they're engaging with healthcare services and delivery. There's a desire for continuity, for trust, for guidance. Our consumers want to know that they are supported and not just being treated, and also being treated and supported in an accurate manner. They want a solution to their diagnosis, and then they want to take that preventative action. It's not to isolate your preferences, but continue to solve for something bigger. Another aspect of it is also surrounded around like the AI adoption and focusing in on how to continue to augment care and services in that way. Those who are kind of the jumpstart leaders in this space are going to shape how care is being delivered, and they're going to be the influencers and how everyone else needs to follow suit.
A very pointed operational way to get started when we think at least about orthopedics is direct access to physical therapy. Direct access is allowable in every state in the United States, but I talk to many members who don't allow direct access. So they don't allow a patient to refer themselves into a physical therapist within their healthcare system. We have seen in a few of our members who are working on best practices, working on referrals, in patient satisfaction and consumerism and loyalty, that allowing direct access through walk-in free PT consultations for patients who are otherwise unassigned has been extremely beneficial to them. We have one member in the Midwest who did that in existing physical therapy offices. Anybody can walk in and get a 15-minute PT consultation for free. 75% of those patients were then referred to one of their employed providers for continuing care. And that is a really easy thing to pilot to. And that's one of the things you'll hear if you take our strategic planning course at SG2, to identify a low-cost pilot before you do a full-blown investment in a strategy. This is something that you can pilot very easily. We have another member who placed PTs in their ortho offices to allow for patients who come in with a significant complaint to see that physical therapist the first day. That also allows the provider to document that on the initial complaint, they saw the physical therapist. So they've been getting physical therapy from day one. You're speeding up that care plan for patients instead of having them book and come in next week or in 10 days and delaying them potentially getting surgery or at least alleviating their pain and discomfort for their injury or a joint pain or arthritis that they have. Those are two easy ways. It can sound like a heavy lift, but if you stick to one office for now, that's an easy way to get started with consumerism and patient loyalty with your orthopedic program.
Such great insights. Thank you so much, Donnell and Nikita, for joining me today.
Thanks for listening. If you like this episode, please subscribe, rate, and review us, and/or follow us on Twitter and LinkedIn at SG2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, SG2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You could find them at Vizient /podcasts. Have a great day.